Welcome back to Wisconsin Family. Today we're filming at the Robinia Courtyard family of restaurants. Big title, and there are 3 restaurants: Cafe, the Black Locust Cafe, Madison Tap, and right here, Jardin. Later on we'll meet with the owner, learn what's going on. They have lots of activities in the actual courtyard as well. Right now though, we're talking a little bit about healthcare, and that's a tough topic. It's getting harder and harder to afford certain things in healthcare. Joining us is Alexander Vang. Alex. And he's the owner of Pinpoint Diagnostic Soundwaves Imaging, also a long name, and you said we can call it PDSI.
Yep.
We're going to go with that.
Sure.
All right. All right, so what this business is it offers low-cost diagnostic ultrasound services. I'm wondering, when we chatted with you before, we learned a little bit about the business. I'd like to know what made you decide to start it.
Yeah, so I've been doing ultrasound for a little over 7 years now, and one of the biggest questions that patients had for me when they came in for the exam was, how much is this going to cost? Mm-hmm. And we just did the exam, so the billing and all that stuff, that was just something that we knew. And so I remember one time I had a patient, they went to the doctor's office. The doctor wanted them to have an exam done. They're just thinking they're going to go get some medicine, probably go back home. But then they were sent to the hospital to have an ultrasound exam performed. The first thing he asked was like, how much is this going to cost? Because I don't have very good health insurance, so it's going to be all out of pocket. And I couldn't tell him. And so he made the decision that he wasn't going to have it done because he didn't know how much it was going to cost. Mm-hmm. And so when he left, I just felt like, I wish there was something that I could have done to help him. Mm-hmm. And that kind of is what led me to say, hey, why isn't there something being done? And so I started, PDSI ultrasound services for people like that who need different alternatives or want to know, like, can I get something more affordable?
Nice to have an alternative, and you sure hate to sacrifice your health care because of the cost. It shouldn't be that way. It's
right.
Too bad. Yeah.
It is bad.
So PDSI, because it's a new idea and a new business that hasn't been around, that's a risky idea. So what was it that made you want to offer this service to the community?
Yeah, anytime it's, you have a new concept or a new idea, it is kind of scary. Our business is a self-pay medical imaging service. So, it is kind of a new concept to the area. But I want to kind of use a little example here. I'm a father of 3. I have 3 little girls. And so in medical imaging or in the imaging department, we always say if the benefits outweigh the risks, it's definitely worth it. And so with the story going back to my 3 little girls, my youngest one, she needed to have oral surgery. And, they couldn't do it at the office, and they told me, well, this is going to be done at a hospital and in the OR setting. And so what I did was I called the insurance to see how much do I need a budget for this procedure. And, the conversation came to about $700 is what, we would have to save up for the procedure. And so that's what we did. We saved up for the procedure. She had the surgery done, and, we paid the bill. And then 4 months down the road, I get this bill from the hospital. It's from the OR, and it says I owe like $2,000. And then, you get into this, that's not right. And you're calling your insurance, company saying, hey, this is what I was told. Long story short, I was stuck with a bill for over $2,000. And it was unexpected, because it's like 4 months down the road. Mm-hmm. And I can't be the only one that's going through this. Other families in the areas are probably going through this kind of stuff. Mm-hmm. And so the whole point of offering this kind of service, I think that if the benefits that I can give to other families is going to outweigh, the risk, it's rewarding. And so I know it's a really risky concept, but I think, it's going to be rewarding.
Great. And Alex, what do you hope to accomplish by offering this low-cost diagnostic ultrasound services to our community?
Yeah, so the goal of PDSI ultrasound service for the community is we want to empower people to be able to choose their care and their costs. That option is not given to people. It's either when you go to the hospitals or you go to your provider, some of them don't know about these different services. Mm-hmm. So it's kind of like, okay, you have to go to the hospital. And the hospitals usually will overcharge you for things. You're paying this, facility fees, you're paying their interpretation. And that's all included with our service. That's not an extra charge or hidden fees with what we do. And so, besides empowering people with the choice, we want to give hope. If you're a family and you're an individual and sometimes you're wondering like, what can I do? Where can I find the services? I need a helping hand. And so we want to be able to give hope to people in the community. And so that's a big part of what we do and what we're trying to provide here.
Oh, that's great.
Alex, we're about out of time. Unfortunately, we could talk about this for quite some time. It's a big topic. I'm wondering if people don't need your services, and I encourage you to look at his website because you have way more services than I imagined. If people don't need those services right now, do you have any suggestions of how they can keep this option available for the future? And we have just a little bit of time left.
Yeah, you know, as we're starting out, you know, cash flow is kind of slow and stuff. So if you want to help keep this service promoted in the community, you know, we have a link on our page to kind of help donate or any support, you know, or spreading the word about the service to people or to your provider and saying, hey, there's a different service here, and so, you know, can you help us get what we need?
All right, and we're spreading the word right now to you. So you can check them out. You can also, if you're interested in learning more, give them a call. Thanks so much, Alex.
Thanks, man.
We're Wisconsin Family, and we'll be right back.